We need to talk about this absolutely massive medical advancement that could change the lives of countless people. Because Dr. Indy Gill and Dr. Nima Nasiri just performed the first human bladder transplant ever, which understand is a huge deal because up until this point, most patients who had to have parts of their bladder removed ended up having parts of their intestines repurposed to help them pass urine. And the built-in problem with that is that the intestinal tissue is littered with bacteria, so matching it up with the inherently sterile urinary tract, it doesn't usually end well. Now with that said, with what we're seeing today, understand that the solution to these problems, it didn't just appear out of the blue. Where Dr. Gill and Dr. Nasiri have actually been workshopping approaches to bladder transplants for years now. And only then, once they had perfected their strategy, they drew up plans for a clinical trial and found the perfect first patient, a 41-year-old man by the name of Oscar. Because you see, Oscar has had a slew of health issues related to his kidneys and bladder. Back in 2020, Dr. Nasiri actually removed both of Oscar's kidneys in response to his battle with late-stage kidney disease and renal cancer. And then actually, on top of that, Oscar also survived a rare type of bladder cancer, and the surgery to remove the tumor, it left him without much of a bladder at all. By the time that Dr. Gill and Dr. Nasiri were actually ready for their clinical trial on bladder transplants, Oscar's years of dialysis, they were beginning to fail. With then all of that bringing us to the day that a bladder match became ready for Oscar. And so you had Dr. Gill and Dr. Nasiri going to the headquarters of One Legacy, which is an organ procurement organization in California, and they joined a team of 7 surgeons working overnight to retrieve a bunch of organs from the donor. With them then bringing the bladder and the kidney to UCLA, and after a shower and a nap, they performed the 8-hour surgery to give Oscar a new bladder and kidney the same day. And notably, well, kidney transplants can sometimes take up to a week to process urine. In Oscar, the connection between the new kidney and bladder, it was immediate. Also, his creatinine level, which measures kidney function, improved immediately. And the good news also doesn't stop there because, a new bladder, it doesn't have the same nerve ending, so doctors were worried that Oscar wasn't going to be able to feel that his bladder was full, let alone hold or empty it naturally. But then, during his first follow-up appointment, when Dr. Nasiri removed the catheter and gave him fluids, Oscar said that he felt that he could go pee naturally. With Dr. Gill then saying that his jaw was on the floor when he got the call from Dr. Nasiri, and he rushed over to the hospital as soon as possible to watch Oscar pee again. Which I know, out of context, sounds like a weird sentence, but in this one, fantastic. But also, understand, they say this is definitely the first step in, quote, the realization of a dream for treating thousands of patients with crippling pelvic pain, inflammation, and recurring infections.